before I close. Why is health insurance so expensive? Remember the president said we need Obamacare to reduce the premium for a family of 4 by $2,500, which of course he lied. Why is it so expensive? Is it because the health insurance companies are so evil and they just like to rake in all the profits, as our Occupy people like to tell us? It's not the case. In 1979, there were a total of 279 mandates in this country placed on health insurance companies nationwide. Most of those mandates said if you sell in this state, you must cover cancer. Okay, that sounds right. We'll do that, right? Anyone like to guess how many we have now post-Obamacare? 2,100 mandates. Now, that sounds like a lot. I brought them with me. Here they all are. These are the mandates placed on every health insurance company since 1979. Now you think to yourself, well, if they're mandated, it must be stuff that should be covered by a health insurance company. Oh no. Hair prosthetics. Why are we paying for Biden's hair plugs? In vitro fertilization. Infertility. Did you know that your health insurance premiums have skyrocketed in the last few years because the state legislators here in Illinois said you got to cover infertility? Why is that medically necessary? I don't have the proper plumbing below my navel to have a child. Why am I paying for infertility? I'm forced to by the Democrat legislation in this state. Health club memberships. Why is that a mandated expense? Oh, I'm not done. Massage therapists, athletic trainers. What else? Oh, did you know in California there's only about 6 health insurance carriers left? You know why? Because on the health insurance companies for all 4 of University of California universities, sex change operations are a mandated covered expense. So in other words, you're paying higher health insurance premiums in the state of California to turn your Audi to an innie, and I don't mean your belly button. That is why health insurance premiums are so much more expensive. Every single time the government intervenes, costs go up. If you remember the Medicare special hospital subsidy, it was supposed to cost $100 million. In less than a decade, it soared to $11 billion. This nation faces an unfunded liability of $65 trillion between Medicare, Medicaid, and Social Security. And that's the most conservative estimate. We found out last week that Obamacare will increase our unfunded liabilities by $17 trillion. Why? Because here's what happens for the states once they open up their mandated Obamacare exchanges. Once you open them, the legislation provides you only enough money to start the exchanges. After the first